Welcome to the Studio Chat podcast. My name is Barbara Thompson. Each week, I'll be bringing you a self-care expert or a message to help you to discover how to live your best life and understand your mind-body connection. Thanks for spending some time with me today. Now, let the Studio Chat begin. Hey guys, welcome back to the Studio Chat podcast. My name is Barbara Thompson. I'm the host. Today, I have a trailblazer joining me here. And she was one of the very first ones that has done this in her industry. And I'd love to introduce you to Dani, the Director of Medi Makeovers. It's lovely to have you here today.
Hi, Barbara. How are you?
I'm really good, thank you. And it's nice. Today we're going to have a conversation about all sorts of different things. But before we get started, I'd love for you to share a little bit about who is Dani, where are you based, and what do you do?
Okay, well, I'm Dani. I'm from Sydney. I'm 58. I'm actually a grandmother now, but I was a single parent for a long time. Yeah, thanks. So I was a single parent for a long time. So I got into the beauty industry because it just was easier so long ago to actually be a bit more flexible with my time, because prior to that I was a jewellery designer. So it wasn't as flexible as the beauty industry. So while I had my salon, I had obviously lots of women that would come in and have treatments, facials, body treatments, whatever, waxing, everything that women do in a salon, in a beauty salon. And this one particular time, we were so busy, to be honest, that if you didn't sort of pre-book your appointment sort of 4 weeks in advance or 3 weeks in advance or whatever, you didn't get in. So consequently, the women started to get to know each other because they'd all be coming at the same time after each appointment. And this one particular time, many years ago, this is about 20 years ago, this one lady came in and she said, I've just gone to get a quote for a facelift with a plastic surgeon in Sydney. And she said, I'm so shocked. It's like $30,000 just to get a facelift. And she said, I've just heard about, people from America going to Mexico to have a facelift. And my instant reaction was, you are nuts. Don't do that. That's crazy. Don't go to Mexico. Don't do anything silly like that. And she said, I've heard that they also go to Malaysia. And Asia's starting to get up in all this sort of, this idea of traveling to go and have surgery. And at the time, there was this one connection from this American company that was in Sydney, and she was offering sort of Mexico and Malaysia. And so as this client of mine was talking, obviously these other women that were in my salon sort of ears pricked up as well and said, how's that? What's that? Because the cost that she was being quoted was something like $7,000 for the same thing that we would have to pay $35,000 for here. There was a meeting happening about a month later, and so I said, all right. So myself and a group of women went down to Bondi, and unfortunately, I'd have to say the woman was not that organised. She was running very late, and then proceeded to say, I couldn't find a babysitter. I can only spend 5 minutes with you. Anyway, all just turned out to be a bit of a disaster. But to actually go to this meeting, you had to give your phone number and details. So then a few days later, she actually called me. And she said, because to be honest, I kind of shut down the meeting because I didn't like the way she ran it. And I didn't feel that she was doing the right things with the women. And so long story short, she rang me and she said, oh, look, I can see that you've got this salon. Are you interested in buying my business? Because I can't do it anymore. I didn't think it was going to be as hard as it was. I'm, new mum, And I said, no, I'm not interested in buying your business. My salon's flat out. I don't have time to even breathe. So, but these women that came down all started, the next time I saw them all, it's like, what is this? Why can we get it done so cheaply overseas, but here it's so expensive? Hence the medical system here. I think anybody now knows how expensive the medical system is. So that's kind of where it all started. So over the next sort of 6 months, my brain started ticking over. And as a bit of an entrepreneur, I thought, well, hang on, let me look into this a little bit more. So I looked in quite a few Asian countries, and 20 years ago, there wasn't much for international people to travel to Asia, but Thailand seemed to be starting to think about international patients, which was good. So that's where it all started. And I honestly was going to just do it as a bit of a side thing to help my clients in my business. Well, then it went bigger than Ben-Hur, as they say. So that's how it all started.
So it's definitely you're a trailblazer. So this was 20 years ago where Medi Makeovers was born, where you were looking at different plastic surgery options and taking people from Australia to Thailand.
Yeah, so what I did was I got on a plane and thought, well, it's just a bit too difficult to do it by email and by phone calls as I was trying to do. So I hopped on a plane, took a week off from the salon, hopped on a plane and went over and met up with this one particular hospital in Thailand, in Bangkok, not Phuket or Pattaya, in Bangkok, and spoke to the doctors that owned this hospital and spoke to one particular doctor who was starting up the international section and understood the way they were doing it, which was good for their system with their ties. But I knew that it wasn't going to work with Australians and New Zealanders, so all Western people, so to speak. I could see that we questioned things a lot more than what they did. What I found was that Thai would, if a Thai person was wanting a particular surgery, they would just go to the doctor and accept whatever was being told, not question, just go ahead with it. We're not like that. We want to know what, why, how, and if, and whatever. We've got 1,000 questions, which was a little bit difficult for them to comprehend. So at first I had to sort of play by their rules, but they even could see that it just wasn't working. So we had to sit down again and I said, okay, let's compromise. Let's do a little bit of what you want to do and a little bit of what I think should be, make things a little bit easier for the hospital, for the doctors, etc. So it evolved over probably the next 5 years and we started getting noted. So, but then the Sydney Morning Herald did a double page spread on us. They sent us a journalist and a photojournalist and they followed us for a week over in Bangkok. And that's when things really boomed because people could see how. So logistically, I'm very meticulous. I like to know. I do not allow anybody to go over there without knowing that they're going to have the surgery. So we have a set of rules in process, a protocol that has to be followed. And obviously over the last 20 years, it has evolved. We're very tight and have been very tight with our protocols for quite a number of years. So we're not for everybody because some people, just want to do what they want to do. And I've seen over the years that either actually ex-clients of mine have tried to set up their own businesses, like a one-man show, so to speak, or, clients just going over themselves, just saying, well, I don't need to follow your rules. I'm just going to hop on a plane, go over there, deal with the hospital and come back. And consequently, things went wrong for them. And that's probably what you hear about on a current affair or something like that, So yeah. It did cause a lot of controversy with the issue, with the industry in Australia. And the other side of it is there's a lot of plastic surgeons and doctors and dentists here that don't want people to travel. And they put a blanket conversation about doctors overseas, which I think is very unfair. As there are certain surgeons in Thailand that you probably wouldn't go to, there's also plenty of surgeons here you probably shouldn't go to either. So it's about doing your homework. And doing your homework here in Australia, New Zealand, anywhere you live, you should be doing your homework if you choose to have surgery here or dental here. And the same thing happens over there. And what I pride myself in is giving people that knowledge, making sure that the client can have that Zoom call with the doctor so that it's not all behind just emails. We are very close. We have our own team. We have our own team of dentists. We have our own team of doctors. We also do knee replacements, hip replacements, shoulder surgeries, really anything that can be done here in Australia or New Zealand or at home can be done in Thailand. So over the 20 years, I'm quite well known over there now. So there's a lot of hospitals that know about me and know that we do have a certain protocol that we expect clients to follow, which in turn makes it easier for the hospital for them to be as a patient.
Mm. Because the industry, if anyone's downloaded this episode, there might be one or two things happening. They want to indulge into finding a bit more about surgery or type of plastic surgery. Now, before I go any further, I'm really careful with my words here because I want to educate and let people know that there is a difference between plastic surgery and cosmetic surgery. And today I'm only talking
There is
about
a
like
massive,
a huge difference, and huge
yes,
difference in the type of surgeon that does the work, huge difference in what they have trained and what qualifications and skills and bodies that they have to report to. So yeah,
yes.
plastic surgery and cosmetics surgery. Do you want to just give me, I mean, I can do it, but I think it's probably better from you to do it, a rough idea if someone
Sure.
has zero knowledge, because some people think it's the same thing.
No, it's far from the same thing. Yeah. So, in a quick nutshell, just to give you an idea, here in Australia, there's lots of people, lots of doctors, and they would be classified realistically as a general or a GP, general practitioner. Then they've decided to go into the beauty field, into the cosmetic field. So they've started doing Botox and fillers, and then they do a little bit of extra training, not through any university, but they do a little bit of extra training to do breast augmentations and liposuction. There is the laws here in Australia are not as strict, and basically the Plastic Surgeons Association and the Cosmetic Surgeons Association are two separate entities, and I think people have to do their homework to find out the difference between the two. It's quite major.
Yeah.
So a plastic surgeon is somebody that obviously has got a medical degree and then furthered that degree. So furthered it to either an extra 6 years or an extra 12 years of study. So it's quite detailed. They study the anatomy and they study different types of surgery, suturing. Quite a lot of detail is involved in an extra 6 or 12 years of study and ongoing treatments, as opposed to a cosmetic surgeon who has the ability and the right in Australia to perform certain procedures. And to be honest, in Australia, a dentist can do it too, which is a bit of a shock. So,
well,
if they can, they don't. A dentist can do it too, yeah. So if they cannot do a complete general anaesthesia, because that's illegal, that has to be done in a hospital. But here in Australia, they can do it through their own little clinic, and they can perform the majority of breast augmentations and liposuction under a local anaesthesia, which a plastic surgeon is shaking his head at totally.
I'm shaking my head at, and I'm not a
yes.
surgeon, but if anyone was going to, there's a lot of fear around surgery. There's a lot of fear around plastic surgery. And the reason why you and I are talking today is I want to unravel this fear. I want us to put it out there. It's not shameful. There's a lot of people like to get and plastic surgery doesn't have to mean a nose job, doesn't have to mean a boob job. We're going to go into a few different things today. So it's not possibly what you think it is, but also it's someone's own business. And if they want to get something done and don't want to share it with the world, that is okay. But it doesn't help people like you who has this great business, who wants to help it, and people are so happy with their results. And you're like, oh, can you do a testimonial? And they're like, oh, no, I don't want to. Like, people know if you've got a boob job, or people know if you've lost weight quickly, or you've had a tummy tuck or something, but you know what I mean? But it's the whole secrecy, and secrecy breeds misinformation. It breeds fear.
Yes, absolutely.
And it breeds, so we're just going to rip this right open today, and we're going to bring the awareness of,
yes, please,
of plastic surgery, that it's okay, and that it is scary, it is surgery, and going to a different country, yes, because you and I have spoken before off this podcast, and at the beginning when I spoke to you, I was one of those people that was like, I haven't been to, have I been to Thailand? No, I haven't. Doesn't interest me. It's not somewhere that I ever want to go to. And then if you think I was going to have surgery in Thailand, I would be someone that'd be like, oh, no, thank you. Only New Zealand or Australia. But after the conversation we had the other day and what we're going to talk about today, you really changed my mind, that it was an option for if anything ever happened to me in my life and it was something that I wanted to consider. You opened that discussion for me. You opened that thought that, oh, it's not what I thought it was.
Great. And that's usually what everybody says to me. It's not what I thought it was. And it's quite interesting because a lot of my clients that do sort of have the courage and come forward and say, okay, let's do it, let's book it. They've still got that fear going until we pick them up from the airport. We bring them to the hotel and they walk into this absolutely stunning hotel that we have, 5-star with gorgeous chandeliers, beautiful rooms. And they go, oh my God, I'm not in a shanty, like tin shed. And I go, what? And they still have that fear leading up to it. And then obviously when, they come to meet the surgeon and then the surgery and and I will say we do have a lot of nurses that come over and have surgery with us because they even say, and these are coming out of their mouths, they would never have surgery in Australia. Because they know what goes on in the operating room. So I think the idea that people have about coming to Thailand is that typical image of going to Phuket or going to Pattaya or one of the islands, where you're going to the beach and there's lots of alcohol and lots of parties. That does not happen with any of my clients. So that's something that I've had to I have had issues with some people over the years because they automatically go, well, I'm coming to Thailand, I'm turning it into a holiday and I'd like to get a tummy tuck done at the same time. And I go, well, okay, how long were you planning to come over? And they go, I'm coming over for a week. And I said, well, sorry, you can't come with us. And they said, well, hang on a second. It's only, a few nights in hospital and then I can come back. I said, no, it's 2 weeks with us. You have to stay with us. You have to stay in the hotel so we can do all the follow-ups. It's a whole system. And they go, well, how am I going to, it's my only time. I've saved up to go to Thailand. And why can't I just fit in a tummy tuck? Then I asked them the question, if you were back home, would you go to the beach after you've had this surgery, or would you go to a bar and party on us? And every single time they come back and go, of course not. Of course I wouldn't do something like that. And I go, well, that's what you're saying to me. You're saying I want to go to Thailand for this party holiday and let me just slide in a tummy tuck or a breast augmentation. So, unfortunately there are other companies that will accept that, but that's not what we're interested in, because for me, the first thing that's paramount is the health of the patient. And of course, the team that I work with, the doctors and the dentists that I work with and have worked with for a long time now, and my reputation is quite strong, is that, I don't allow clients that are not going to follow a certain protocol to come over. And we've seen a lot over the years. We've seen people that have tried to slip in the odd drink and they get, or the little cigarette. It's not going to happen. It's not going to happen. We take this extremely seriously, and so do the plastic surgeons and so do the dentists. So, there's a lot of things that people have misunderstood about going to Thailand to have a procedure. And so we clarify that usually in the first conversation with somebody. But I will say, sort of the last few years, people are a bit more understanding. They just thought, I had one lady turn around and say to me, she goes, oh, look, I just thought I'd throw it in and maybe, get away with it, but I didn't think you would let me do that. And I said, no. The other thing that we really like is for people to come over on their own, for women to come over on their own, because especially we do a lot of mummy makeovers or a lot of post-weight loss procedures. So it's quite big surgery we do. I can honestly say most of our clients are doing two or more procedures each trip. So it's something that you as a person needs to recover on your own, and each person can be different. Some people have got a high tolerance of pain, some people don't, and some people that tell us they have a high tolerance of pain are not usually that way when they've had surgery. So we make sure that we follow you, we tell you, we explain to you what's going to happen to you over the following days. And sometimes it's actually easier if you do it on your own, which can be daunting for some people before they come to Thailand. So they're fearful of that. They think, oh, how can I possibly get on a plane? How can I do anything over there? How can I, because it's the unknown. But I would say 80% of our clients do come alone. And when they get there, they're happy about coming alone. So just for instance, if a few days after surgery, when they go back to the hotel, they might just want to rest or watch TV. If they've got a partner or a friend with them, they're bored. They want to maybe go and sightsee, or they want to go to the shops, or they want to do this, but you're not feeling well enough, and you shouldn't be at this point in time of your recovery. So what we found is that people have pushed themselves because they were trying to please the partner or the friend that's going with them, or they want to go on temple tour and things like that. So this way people can come over there on their own and they can recover. And we are there. We're there every step of the way. And the nurses come to the hotel and visit and do dressing changes and check up. So it is very important that I think In most cases, the client, if they can, come over on their own. And then we get people that come over and they've got a partner or a friend that is very sympathetic to the situation and totally respects the protocol that has to be followed. And that's great. That's fabulous. But we've had many, many situations where it hasn't happened like that. And I've had to step in and for the comfort and the protection of the client, we've had to either separate the person and put them into another hotel room or something like that. But it doesn't happen realistically over the last 5 to 8 years. It hasn't really happened because we are much stronger and we really do know how you're going to react exactly post-surgery. So it's all about communication. It's all about understanding. And also know that Bangkok, we do not do surgery in Pattaya or Phuket. We do not offer it. And I know that there's other companies that do, and other people do know that you can go to Phuket, you can go to Pattaya, which is beach areas. But we do pretty big procedures. We don't just do, we also do just the standard breast augmentation, but the majority of our clients are having breast surgery as well as tummy surgery. But you can't be out in the heat, and Thailand is a hot country. Ugh. So if you go to Phuket, for instance, and I know many people have gone to Phuket, and it's great for a beach holiday. It's fabulous for that, which you can get out, you can go to the resorts. Your actual hotel room is usually the only room that is air conditioned. When you come out to the resort, and these are glamorous resorts, and you go and have breakfast outside or you're sitting outside, they're not air conditioned. It's all out. It's all out in the open. So you're trying to recover from surgery, which you've got a lot of swelling, which is natural post-surgery. And you really, in Phuket, don't have any other option but to stay in your room. Whereas in Bangkok, at our hotel, for instance, we're attached to an 8-level shopping centre. It's gorgeous. It's absolutely stunning. So you can come downstairs to our 5-star hotel. You can sit in the lounge area. You go to the executive lounge for breakfast. There's another lounge area there. There's lots of areas that you can come and read a book or get out and do things, or go just open a door in the foyer and you're straight into 8 levels. So you can go and sit at a coffee shop. Everything is air conditioned. So you don't feel like you're just looking at 4 walls post-surgery. So there's a lot of things that people don't think about when they're actually thinking about surgery in the recovery phase, and that's what we focus on as well. So it's quite interesting, people's perception of what Thailand is to what it really is, or I should say Bangkok, because that's really where we go.
Yeah, and the stuff that people may overlook, that's a really big deal when you're recovering from major surgery, and just the infection as well with the heat and the sweating and the
Yes.
So first of all, before we get into the type, just a couple of examples of the types of services that you offer clients, I'm just interested to know if people travel on their own with you and get a surgery done, how often is someone by themselves? Like, do they have a number they can call, or do they have, just so people can visualize and know what it would look like if they did come over by themselves?
Okay, so our process is you get on a plane, you arrive into Bangkok, and we have someone there to pick you up. We bring you straight to the hotel. So we get you to arrive a minimum the day before your surgery. So some people want to come a few days beforehand because they might want to go and do the temple tours, but most people just want to get their surgery done and get this. This is just a surgery trip. So pick you up from the airport, take you to the hotel. And then most of the flights, like what we're seeing now, is they're arriving sort of in the afternoon, mid to late afternoon. So by the time you get to the hotel, you've just been traveling a certain number of hours. So usually you want to come back to the hotel, maybe have a swim if you want to, or just relax, literally have dinner and just go to sleep. So we would have already given you all the details about your surgery the following day, about what time you have to stop eating, what time you have to stop drinking water, what time your pickup will be. So really we leave you alone that night. But one thing I must stress is that we are on call 24/7.
Right.
So you can access me, or you can access one of the other client managers 24/7. So there is absolutely no time that we say, right, you can't ring me at 1 o'clock in the morning. And believe me, I've answered the phone many times at 1 o'clock in the morning, even when people are just, worried about something that is really normal, but it's just to make them feel better and okay, I can go back to sleep now. That's fine. So there is that 24 hour access at any time. the one thing we've got with our hotels, because we've been using our hotels for many, many, many years, is they know and understand our clients. So there's no problem at all for the patient to ring downstairs and have any issues. If they can't do that, they can ring them, and then the hotel knows me or knows sort of anyone that's associated with us and our surgeons. Right. So they can also contact them if for some reason they don't ring us. So there is that communication between all of us, because it's been going on now for, like with this one particular hotel that we use, we've been using them for 13 years, but we've been using that chain of hotels for the whole time I've been in business. So they all know me and my clients really well, and the process that we have. So the next morning you'd be going to surgery. So we pick you up, and then the staff at the hospital, our staff, take over. So you are then prepped, the communication, the consultation, everything is needed, and there's no rush. There is absolutely no rush with the consultation, which you've already, by this stage, would have already had a Zoom consultation with the doctor, and also had your full assessment given to you, everything detailed. You would have done tests before you came over. I mean, there's a lot of communication before you actually get on a plane to come over. Yeah. So that 100%, you know that when you get on that plane, you know exactly what's going to happen to you when you arrive in Bangkok.
And can I also ask, before you take us through after so we're at the hospital now and getting all our pre-surgery checks done. What's the, excuse my naivety of asking you this question, because it's weird that in today's age, I still have to ask this question. Most people speak English. You're speaking English the whole time. There's no translators. What's that looking like?
No.
Okay. So all
There's
English.
no translator. Our entire team that you come across speak English, because we can't. Look, it was very different 20 years ago. Let me tell you, it was very different. Because they weren't used to a lot of Westerners coming into their country and having, and you can't expect a patient to come in and suddenly know the Thai language. And we did struggle then, because we didn't have little apps that we could do translation on. I mean, thank God for Google Translation now, things like that. So, but you got to understand the Thais, Thai is their first language. So what I do say to clients is speak slowly when you speak to the nurses or our staff over there. Speak slowly to them so they fully understand. We do have a translation sheet, so even post-surgery, which I've done for many, many years now, we've had set up. So if you're not feeling really well, and especially with facelifts, where you've got a bandage around your face and you're not really wanting to talk, you can just point to a question, and it's there written in Thai for the nurse to see straight away. So you're trying to talk, but you haven't got the strength to talk, So now, the other thing with us post-surgery is it's one-on-one. So you're put into a room where you've got your own nurse. So that's very different to what we had many years ago. So our whole system and our whole process has changed very much so. So it's really almost like being an ICU at all the other hospitals, where it's one-on-one. So that's the reason why the communication level is really good. Not very long ago, one of our nurses there struggled with the accent of the client and couldn't understand some of the words. And we have, the Australian vernacular, the New Zealand vernacular, we have words that probably aren't in the English language. Yeah. And, the nurses are looking at them going, I can get some of your words. I don't understand what you just said there. So Google Translate is fantastic. So it goes on and gives them a rough idea of what they have. And it's quite fun. It makes everybody laugh, when some of the words are just not in normal language, So there's a lot of Australian slang, which, a lot of people use, but we don't realise other people will look at us and go, what was that word? I've never heard that word before. So there is no problem now. And I can honestly say that absolutely no problem. It has been like that for many, many years. To see that, and the doctor speaks English really well. The dentist all speak English really well. I mean, the whole team, everybody that's Thai speaks English really well. So there's no problem there.
I thought that was the case, but I didn't want to assume, and I'm sure if someone's listening, that possibly could be someone's question. So I thought I would ask that for someone that can't ask that. So
again, I can say that might not be the case in some situations, but I can guarantee that in my situation with Medi Makeovers, that will happen. And I have seen that in other areas where, there is a problem, but not with us. Absolutely not with us. That's one of the things that I pride myself on. Mm-hmm.
It's definitely something that you wouldn't want a problem. That's the time of your life where you wouldn't want language to be a problem.
Yes,
You
yes,
know, you
yes.
ask for a boob job and you come out with a new nose or something. No, like you know, but
That's never happened.
no, I'm not saying that. Yeah, but I'm just putting a bit of a
I understand.
light
Yeah,
spin on the
sure.
situation.
Yeah, yeah, yeah.
Okay. So if we go back to, you had walked us through the process of, okay, we're getting prepped up. I guess sometimes we get, depending on the surgery, we're getting marked up for surgery, and then obviously we go in for surgery, and
Yes, yes.
then
So you're going for surgery. Yeah, what I say to most clients is when they're ready to go in, when everything's ready and they feel really confident with the surgeon and everything, which they usually are by that stage anyway, they go into the operating room, and I usually say to them, because I'm 9 times out of 10 I'm there, I usually say to them, see you in 5 minutes. And in that case, it's because they're going to be knocked out, and for them, 5 minutes has passed. For us, it's probably 3, 4, 6 hours, 8 hours, whatever. But for them, it's like they're waking up and they've been asleep the whole time. So what they do then is they go into recovery, and then they go into their wardroom. And obviously, for each procedure, it's a different length of stay. So a breast augmentation, for instance, is an overnight stay. They are discharged the following day. A tummy tuck, it's a 3-night stay. Multiple procedures, it's all individualized, so it's very personalized. So then from there, once they're obviously there, the nurses are taking care of them 24/7. Then when it's time for them to go back to the hotel, we take them back to the hotel. And then we have a system according to what the doctor suggests for the nurses to come and visit them at the hotel. So it's really, now's the time to start resting. And this is where the majority of the people pre-traveling to Thailand start to worry about, because they think, well, what am I going to do? I'm going to be very, very bored. I've got nothing to do. But when you've had surgery, all you do want to do is rest. So it's a conversation I have with most of them, and they go, oh my God, I thought I'd be able to up and walk around. And I said, well, you just had a belt lipectomy. You've had a breast augmentation, breast lift, breast augmentation. You're not going anywhere. And their body's obviously saying, we're not doing anything. We need to rest. So they're just spending the next few days resting and recovering. You can go down to breakfast every morning. And I usually do tell clients to make the effort, get up, get yourself sort of as prepped as you can, and walk down to breakfast. And so that makes you feel better to be able to, because sometimes if you stay in your room and you're just not moving too much, it can cause other issues, more swelling. And you just want to feel a bit more normal. So to go downstairs, and trust me, the hotel knows that our clients are there. So they're used to our clients being bandaged. So it's no shock for them. I know that the client might feel that, oh, I've just had a facelift, I've got this mummified bandage around my face, but the staff are beautiful. They don't and actually they'll probably just say, give you more help, with getting your food or whatever. So I always tell people, go down to breakfast. And then by that stage, you're feeling a bit tired anyway, go back to your room, rest. It's a good time to catch up on all the Netflix or reading or whatever you need to do. This is the time. So for the first week post-surgery, especially with the big procedures, you're really not venturing out of the hotel, but it's not bad. It's actually really lovely. And people, and one of the things that mothers usually say to me is, this is fabulous. I've got no children running in. I can actually rest and recover. I can catch up on those shows, those TV shows that I haven't watched for ages, or the movies. So it's really about listening to your body and actually just following what your body is telling you it needs. And 9 times out of 10, it's just resting. Of course, we keep in touch. We tell you when the nurse is coming. But if any stage that you're not sure about something or you're worried about something, you get in touch with us. The doctor can either ring your room immediately, or we actually bring you back to the hospital, or whatever is needed, it's covered so that we can make you feel relaxed and secure. So this really is a time for you, and we really say this is your time. This is something that you've got to. So you can imagine, if you're not feeling well, imagine your husband snores, for instance, right? He's decided to come with you, and you've had to quickly rearrange, babysitter. So you've got your mother-in-law trying to look after. So you've had all this stress, and when really you should be leaving the husband at home to look after the kids so you can have your own time. But some women are going, oh, I can't do this on my own. That's perfectly fine. The husband snores. You're trying to recover from your surgery. Your sleeping patterns are like, I'm sleeping for 2-3 hours, and then I'm waking up a little bit, watching a movie, I'm sleeping again. he's gone off and done whatever or your girlfriend's done whatever she wanted to do, or your friends. And then they've come back and it's like, right, okay, I'm tired. It's 9 o'clock. I want to go to sleep, but you're wide awake. And then he's snoring, all that sort of stuff, or somebody wants the TV on, you don't want the TV on. Do this on your own if you can. It's really good to spend this time on your own. It's really soul encouraging as well for you to just rest and relax and let your body just heal at its own pace. And also do things that you probably haven't done for a long time, like get a foot and leg massage, go and get a pedicure, have a facial, do all these things, for you. Make this about you. So this is what we encourage to happen, because each hotel has got an amazing spa in it so that you can do it. In Thailand, you can get a foot and leg massage for 1 hour for $10. I mean, and it's not a crappy little massage. It's a beautiful massage,
Oh,
so
man.
it's really good. So it's about pampering for yourself. Yeah. And then at the same time, if you're coming over for surgery, one of the things we also like to do is, when was the last time you had a dental checkup? So cheap over there, get it done. We do a dental consultation for free. You might just need a clean and scale. You might need some teeth. You might want some teeth whitening. You might happen to need a filling, or something. We also include that in it, because why not get it there? It's usually half the price, if not, cheaper than what you're getting back home. So, and there's other things you can do. Like, we do lots of skin treatments. There's so many things that you can do over in Thailand in your recovery time as well. So the mummy makeover, that's a term coined by surgeons a long time ago about the breast and tummy procedures, because that's what is usually related to pregnancy, obviously. So the mummy makeover is any type of breast surgery, be it breast augmentation, breast lift alone, or breast lift with an augmentation, or a breast reduction. And then you're talking about the tummy area. And with the tummy area, there's lots of different procedures. So there's the mini tummy tuck, the normal standard tummy tuck. Then we have the extended tummy tuck. We have the belt lipectomy, where it's a circumferential lift, which is completely all the way around. We have what's called the fleur de lis. So you have the tummy, like an extended tummy tuck, and then it goes up, an incision up the upper abdomen vertically, and it brings in so that you can have a bit of a waist. So there's quite a few. And that's why when somebody says to me, oh, how much is a tummy tuck? Well, we don't actually price anything up. I mean, there's prices we have for all of these procedures, but it's up to the surgeon to say what you're going to need. So that's why we want the medical form filled out, and we want the photos sent in so he can see exactly what you need. And then after that, we then go into a Zoom consultation. Through all the procedures that we've done and the protocols that we follow now, we're able to send out a very concise surgery assessment for people. So before they come over, they know that their surgery is going to be this. There's no hidden charges. There's no hidden surprises because of that. So that's the mummy makeover. So that's the tummy and the breasts. But over the last 10 years, there's been a lot of women that have put on weight, men too, not just women, men too, that have put on weight, lifestyle, whatever situation, sometimes through pregnancies, sometimes just through lifestyles or whatever. And now with the gastric sleeve surgery and the gastric bypass surgery, we're now spending a lot of time with clients that have had the weight problem. So they've been struggling with their weight. They're either putting on weight, losing weight, putting on weight. It's like that yo-yo dieting, which is not good for your health. But what happens is when they do decide to have the gastric sleeve or the gastric bypass, where they had a problem with the weight to start off with, which is now being sorted because they've lost all the weight, they now have another big problem, which is the skin, the sagging skin. And I've seen we've done hundreds and thousands of clients, and I hear many people say to me, I would never have that procedure because all they have to do is go to the gym and lose weight or get on a diet. They're just being lazy. It's nothing like that at all. That is completely the farthest from the truth. You have multiple pregnancies or you've lost 50 kilos, you can go to the gym as much as you want. You can go every single day. And I mean, we've had gym owners, we've had gym instructors, we've had all people like that that have come over and had surgery. And so you can fix the internal muscles, but the skin's been damaged and it's been stretched. So it just hangs by this stage. So what you need is a surgeon. It's not going to bounce back. It will bounce back a little bit. And obviously the younger person, they probably have more of an opportunity for the skin to bounce back. But the damage, I've had clients that are 23, 24 years old that have never been pregnant but have lost 40, 50 kilos through gastric sleeve surgery. We've had to do tummy tucks on them because the skin's just sagging. So, and they're at the gym all the time, and the tummy muscles are all fixed, but they can't get rid of the skin. So you have to have these procedures. So the majority of our clients are having the mummy makeover procedures, but that's not just because of pregnancy, that's because of weight loss too. So big procedures. And one thing I will say, it's very, 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 very important to make sure that when you're going down that path of having these particular procedures, even just a breast augmentation, but more so when you're coming to remove skin that has been damaged or stretched, the elasticity is gone, you have to make sure that you're dealing with a plastic reconstructive surgeon. You cannot be dealing with, here in Australia, a cosmetic surgeon, or even someone that's just maybe a plastic surgeon but hasn't got the expertise in this sort of multiple procedures, skin removal surgery. So that's why I've got the surgeons that we've got, because obviously that's our clientele. But those surgeons also do breast augmentations. They also do nose surgeries. They also do all of those. But their skill set is incredibly high, because when you're dealing with stretched skin, it almost like becomes tissue skin. So the suturing technique has to be different. So the skill set has to be much higher. So don't just, what I see here, and believe me, a lot of clients that have come to us have had surgery in Australia or New Zealand, and they've gone the cheaper route, and they've ended up with a cosmetic surgeon or maybe a plastic surgeon that hasn't had the expertise. And what I've seen has not been pretty at all. And it's quite interesting, because that's what they expect to happen when they go to Thailand, when it's not. So 20% of our work is repairing botched, if you want to say, surgery from here, and it's not been pretty at all. And so the skill set of our surgeons, and they're surprised that it happens here because of what Australia allows, with the cosmetic surgeon to be able to do that. So that's not good, but that comes down to the choice. And one of the ladies that I was speaking to that had actually an extended tummy tuck with a surgeon here in Australia, and it didn't go well at all for her, and we ended up having to help her. Her first option was all about price. All she kept saying was, I was given a limited budget and I had to hunt for a surgeon that could do what I wanted and what I needed. And she'd had 3 children, and she had eventually had the gastric sleeve surgery and had lost 45 kilos. So her skin was quite damaged. And it wasn't good, the results. So don't go about price. And now the good thing about coming to Thailand is that you do have an opportunity, for instance, like the price of what our highly skilled plastic reconstructive surgeons are, is you'll be paying, to give you an idea, you'll be paying the price of having one surgery in Australia. You're able to get virtually 3 procedures done in Thailand. And it's not botched. It's not, low quality. It's not anything like that. It's going as if you're going to the highest quality surgeon, say in Double Bay or Macquarie Street in Sydney. That skill set is what we've got. But of course, here in Australia, they can't charge what we can charge, what our surgeons can charge.
Why is it so cheap in Thailand?
There's several things. Number one would be just the cost of living. The cost of living in Thailand is cheaper than the cost of living here in Australia. All the surgeons are fully insured over there. So they're all, I hear a lot where surgeons have said, they don't get insured over there. They don't have to pay the high insurance fees. It is very high insurance fees. It's high insurance fees everywhere in every country. What I find is that the cost of living, the nurses, the cost of staff over there is cheaper than the cost of staff here. So if you factor in those 2 things, that makes a big difference. What I've found is that also the cost that the surgeon charges, if they do charge less in comparison, if you go like for like in the quality of if you start balancing out the prices, the surgeons do charge less per procedure than what they would do here. They work longer hours. So our surgeon has Sundays off, but he works 6 days, and he will work usually all day. And there's some nights that you'll still see him in the operating room at midnight, 1 o'clock in the morning. So it's some surgeons are like that here, some don't do that. You know, there's a big joke that Wednesday is golf day here for surgeons, you know. So things like that. It's relative. It's all relative. The cost of living is the biggest thing.
Yeah.
It is cheaper, and it is cheaper to have staff over there. So we have a lot of nurses. We could employ 4 nurses for the cost of 1 nurse here. So that's a big difference. So it is like that. And look, I'm not going to say that you can't get cheap quality surgery in Thailand. Of course you can. You shop around, you can get things a lot cheaper. But the reason why I want to keep this going is basically because you must think of quality first when you're thinking of surgery, and then price. So a lot of the people that come to us is that they have gone to the top end surgeons, and they've gone for consultations, and that consultation's cost them $500 just to even have a chat with that surgeon, and they want that quality, but it is out of their reach here in Australia. But we can give that to them over there. They're staying in 5-star hotels. They've got the plastic reconstructive surgeon, which is highly skilled, the dentists, which are highly skilled. They've got the quality of that top-end, high-end surgeon here, but it is cheaper in Thailand because of the cost of living over there. And the surgeons just simply do not charge as much for the procedures.
And you mentioned earlier on that the type of surgeries that your company does and people come to you for used to be, I guess, boob jobs and mummy makeovers, but now it's extended to the gastric, the gastric sleeve, and then you said knee surgeries, hip surgeries, dental, nose, facelift. Have I missed anything off?
Basically, any type of procedure that you can have or want to have in Australia can be done in Bangkok. So we've done hysterectomies, we've done, oh my God, anything, we do a lot of labiaplasties, we do other things that people don't really relate to going overseas to having surgery. Knee replacements, hip replacements, we've done ears pinning back, we've done we've done embraces. So when we first started 20 years ago, it really was very difficult to sell the idea of coming over for a knee replacement, or sell the idea even to have a facelift or a tummy tuck. It was really, the whole notion was going to Thailand to have a boob job, to have breast surgery. Very quickly, people were, especially, I would have to say, the Sydney Morning Herald report that, 2 pages there helped us out quite a lot. And it made the journalists were able to just do whatever they wanted to do and see and report whatever they wanted to report. And they were clearly very shocked because they came over thinking it was going to be something very different. So then all of a sudden you've got an unbiased report and photographs of a situation that was quite open. So, and they were given free range around the hospital. They could go in and speak to anybody they wanted to, and their perception changed very quickly, which was great. So as the years have evolved, the dental procedures have gotten larger. People would just come over, maybe have a filling or a crown, or now we get people coming over for dental implants, so major teeth, mouth reconstructions. I had one lady that was quoted $155,000 here in Australia, but it was plus because she couldn't get the final price because they wouldn't give it to her. They said as we go through the stages, she didn't want to just have dentures. She had lots of issues. She was on medication many years ago, caused a lot of issues. And so she approached me and she said, look, I really don't think you can help me, but this is the situation. She had to come over twice to Bangkok, and the whole thing took maybe about 10 months. So for all of her flights, accommodation, the surgery, everything that she needed to do, the cost was $60,000. So her price was $155,000 plus. She was never even given a final price. So for $60,000, she's now smiling, eating. Her health is much better. Everyone kept saying to her, just get dentures, but the problem was her gum was shrinking even more. So the dentures would have to be redone virtually every year, if not every 2 years. She didn't sort it out. So there's procedures that there is highly skilled dentists in Thailand that are able to do them because they do them more often. There's clearly a lot more people in Thailand than there is in Australia. So the experience rate is much higher. And now, especially over the last 10 years, where Thailand is becoming a very major destination for international travellers, the doctors and the dentists there, their experience level is incredibly high because they're turning over numbers that Australia could never, the practitioners here could never do, purely just by the numbers here in Australia or New Zealand, for instance.
Yeah.
So now, as I said before, one thing that COVID did show me very clearly, because prior to COVID, I would not have offered a gastric sleeve surgeon in Thailand, because my understanding from all my clients that had had the gastric sleeve prior to coming to us for the skin surgery was that they would see the doctor and then they would see dietitians, and there was this 12-month follow-up. One thing that was very clear from COVID, with not just gastric sleeve surgery but other procedures, is you basically never saw your surgeon. You'd see your surgeon on the day of the surgery, but then after that it was all done through phone calls, Zoom calls, whatever. Yeah. So now we have, for the last 6 months, offering an amazing gastric sleeve surgeon in Thailand, and you do the Zoom calls, exactly the same process that we do. You are given all the dietitian information and you deal with the hospital. Everything's given to you in the same process that would be done here if you were going for a gastric sleeve procedure here. You still do the Zoom calls. You still, you're there for 10 days, 14 days in Bangkok having the procedure. You spend 4 nights in hospital. The average night in hospital for a gastric sleeve procedure here in Australia is 1 night. In Thailand, it's 4. So you're really monitored the 4 days. And then if you're monitored while you're in Thailand, and then we do full-on follow-ups afterwards. So all of our patients, not just the gastric sleeve, you are monitored for 12 months. So we do photo calls, Zoom calls, any questions for the next 12 months is all part of the service as well. So you still have access to all surgeons, all dentists for 12 months. So that's one thing that people have a fear of, is that they come to Thailand, they'll have their procedure and then they'll never be able to access the doctor again. What if there's a problem? What if they get, they come back to Australia and there's a major problem? Well, that's not the case with our clients. So there is a certain number of days and nights that you have to spend in Thailand for your particular procedures, and that is minimum. I've just booked a lady that's coming over for a fleur-de-lis tummy tuck. Her minimum stay was 14. She's decided to stay 20 nights. So the minimum stay is what we accept. If you decide that you can't stay the minimum stay, you're not our client. You can't come with us. It's as simple as that. That's the absolute minimum for your procedure. So she's chosen to stay 20 nights, and because she knows that she goes back, she's got young children, they're in their sort of teenage years, and she just said, I don't want to be washing clothes, I don't want to be doing anything, because that's what I'll be doing when I go home. So she said, I'm going to stay an extra week. So and that happens, and she's coming over on her own.
So let's talk about the relationship that you have with the surgeons there, because there's something that I picked up quite early on when you and I talked previously. First name basis, a bit of a mateship. Like, I could just see the relationship between you and the surgeons was very close, which it needs to be.
Yes.
Yes. Yeah, and also the fact that if anyone's listening to this and you might have some questions, there might be a type of surgery you're interested in, or you're wanting to get a surgery done, but you don't want anyone to know, please feel free to private message me on Instagram and send me a message. It will stay private, I can promise you that. And what we could do, if we get enough questions through, we could look at possibly getting one of the surgeons on for a quick 5-minute, 10-minute chat about the particular procedures and answer anyone's questions in a further episode, if that was something that, they would be open to.
Yes, absolutely. They're very open to that. Yeah, doctors or dentists, they're all very open to communicating. So basically, the procedures, when I first started with the surgeons, we had, as I said earlier, I had to follow the hospital protocols. So, which meant that I didn't really have a lot of access to the surgeons because they had a system set up. So, but one thing that I said right from the start was I had to obviously meet all the surgeons. I had to speak to some of their patients. I had to see and just feel how they were, because this one particular hospital had 16 plastic surgeons. So I did not want to be just the next one in line with my clients, which is what they do over there for the Thai patients. It was kind of like the patient's folder just turns up and the next surgeon is what that patient has to accept. That was something I said to them right from the start I was not going to happen. So I interviewed all 16 of them, spent time with all of them, and basically came down to about 6 or 7 surgeons that I was quite happy with. And then I said I wanted to sit in the consultations with them. And it was very difficult for them too at that time because of the English. And we also had an English translator. But so I had to, that hospital found out very quickly that I was not going to follow their rules so much, which meant just leaving my patient in there and just basically not really saying anything, just accepting what the surgeon was going to do. And then the patient walking out and then asking me 1,000 questions. So we had to sort of break down that barrier very quickly. So that's what happened. We were with that hospital for about 4 or 5 years. Then there was issues with, actually one of the major issues was the Bangkok floods that happened. So that hospital ended up the first level underwater. So we had to quickly move patients out of there. And I had, by this stage, started to get to know some other hospitals. So we moved to another hospital. And that was really good because that hospital, by that time, those doctors and the owners of the hospital knew who I was. They knew what I did and how I did it. And so they were quite open to having me set up the plastic surgeon side so that it was very integrated with the Western system. So that became a lot easier. So then the surgeons, basically, we had a one-on-one relationship. And I knew that certain surgeons were better with faces. I knew certain surgeons, through the communication with them, that they would prefer to do noses or breasts or tummies or whatever. So then it became, when the client sent in the details, we would then communicate with the surgeon and they would say, okay, yeah, I'm happy to do this, or maybe no, this particular surgeon would be the one that's best off with this. So, and, that's what happened over the next number of years. So now where we're at is that we're with a team now that basically are the highest skilled surgeons I've ever worked with, right? And we are very one-on-one. So our communication level is very intense. Also with the patients before they travel, they would have already had, if not one Zoom call, 2 or 3 Zoom calls with the client, with the doctor or the dentist. They would have really had all their questions answered. And the other thing that happens is, like today, for instance, I had a client that's arrived in Bangkok and she's unsure about a couple of things, and I just quickly text the surgeon. Within 5 minutes, I had an answer, gave it back to her. She's relaxed. It was all, pretty basic stuff. But, I will tell you, because a lot of women go through this, she got her periods, right? So it was a big freak out that she got her periods on the day she was having a tummy tuck, right? And that happens, especially because you're a little bit nervous, so your whole cycle goes out. And her thing was, oh my God, I'm about to go into an operating room and I've got my periods. And the doctor just went, well, that's normal, no problems, don't worry about that. Just that's like, put that back. It's not even a problem. So it settled her down very quickly. We answered it within 5 minutes. She was calm. She didn't have to go into hysterics or anything like that because she was so panicked about it.
Yeah.
And that happens a lot. So, but any question, I can get an answer very, very quickly. And because we are a team, we're not an agency as such, which is, we're very different now. We've evolved. We work with doctors, with dentists, and we're all very much a team together. So we don't all move forward separately. We all move forward together. So that's the difference now with us. So we're very, very different to maybe what people see as other companies out there that offer surgery overseas.
Yeah. So it's just been we could talk for ages on this, but I think it's a really good. We've talked about something that most people don't talk about. We've talked about plastic surgery. We've talked about, going overseas for surgery. Before we go, is there anything, have you got because you've been doing this for a long time, have you got words of wisdom or a certain quote you want to leave people today with?
I think there's just a couple of things. I think with the gastric sleeve surgery, if I could just sort of go back over that, because I think that's something that is now a lot of people are starting to look at, because they have yo-yo dieted for a long time, and they're worried that, and I know because I'm experiencing it now with the inquiries that we're getting through, you might be considered on the BMI, the index, the body mass index, as low for some surgeons here. So you might have a BMI of about 30, and some surgeons here will say, no, I'm not going to even look at you until you're 35. And you think, well, my goodness, I've just been, the last 10 years I've been trying to lose weight. I'm up and down, up and down. That's very different with us. So what the doctors do look at is your health. And yo-yo dieting is very, very bad for your health, basically, and it's not good for your heart. So somebody that has been yo-yo dieting and has been trying, and it might have a BMI of maybe 28 or 29 or even 27, when they look at the medical records, they might agree to that situation. So I've just had somebody approved at a BMI of 30 that she saw 3 surgeons in Australia, and they all said, no, the minimum we'll take you is 32. And she's going, so what are you trying to do? Tell me that I have to now put on weight for you to even, see me? I mean, it was just really, they couldn't understand it. So she's been accepted with us because of her history and her medical background in the yo-yo dieting. So that's where we can see we can help a lot more people with getting them that maybe be refused by surgeons here. So there's that side of it. But the other side of thinking about coming to Thailand, I think you've got to get the idea of that beach holiday out of your head when you think about Thailand and overseas surgery. Unfortunately, there has been a few shows. One comes to mind of Beauty and the Beach, which was pretty horrific, actually. I was actually asked to be part of that right from the start, and I refused because even the word beach in that title was totally incorrect, because you do not post-surgery go to the beach. You do not go and sunbake. You do not do anything like that. And on that show, and I mean, I'm sure you can get access to it probably on YouTube or something now, you'll see that each client at the end is holding an alcoholic drink and sitting by a pool. I mean, that is just, and this is while they're still in Thailand. And there was something that I was totally against. So that's again another reason why we don't do the beach areas like Phuket or Pattaya. So what you have to realise is that one of the lines that I say to people when you've decided to have surgery or major dental is you are now getting on a plane to go and have your treatment instead of getting in a car and going to see the surgeon. That's the difference. Everything else is the same. You must treat it as the same. So you get on that plane, you get over to Bangkok, and we're there at the other end that will pick you up and look after you from that point. Everything that happens over there, even though you are staying in a hotel room, believe me, your recovery is going to be better because somebody else is making your breakfast and food, somebody else is making your bed and cleaning your rooms, whereas if you were home, you would probably be more tempted to do that. So your recovery is much easier over there and quicker. But you are now getting on a plane. That's the only difference. The only difference is you're getting on a plane to go over there. And then by the time you get back on that plane to come back, you are very, very much near the end of your healing, So, of course, there's still going to be a bit of swelling and still, stuff that you have to come back and you rest up a bit more, but you are very safe. You're all given a fit to fly certificate at the end before you get on that plane. Yeah. The surgeon's not going to put you on that plane if you're not ready. And that has been extremely rare. And let me tell you, when we haven't been able to issue that fit to fly certificate, they've been a bit cheeky and they've been sneaking out and drinking alcohol and doing stuff like that. So we've nipped all of that in the bud now. So I can honestly say, especially over the last 8 years, never had any issues with anybody not being able to get back on that plane when their time is to go back that we've given them. So that's the difference, is you're getting on a plane to go over there, but everything else has to be the same. You cannot turn this into what people have an understanding of a Thailand holiday. It's not the beach. It's not the alcohol. It's not the partying. It's not anything like that. You've got to do the right thing by your body, and listen to the surgeon and the dentist.
Because it's your life. It's your life.
Absolutely.
Yeah.
And the one thing is, if the recovery, say for a tummy tuck or a mummy makeover, you're over there for a minimum of 14 nights. If you follow our protocol, which is, to be honest, very easy to do because you're doing it in style, it's very easy to do. Your recovery is so quick. It is so quick. So that by the time you get back on that plane and you go back to your normal life with your kids running around or, whatever, you are in a much, much more further position than you would be if you actually had that procedure here. One thing that is very strong that people have told me, when they have the surgery here back home, they usually don't see their surgeon or any nurse for 1 to 2 weeks post-surgery. So I find that quite shocking because with us, you're seeing the doctor, you're seeing the nurses in those those first 2 weeks, you're seeing them quite a lot. And that's usually, as the doctor has said many, many times to me, that's usually the time that things can go wrong. That's why we give you that minimum stay, because that's when you've got to be watched. And here in Australia, I had one lady that had a mummy makeover and she didn't see her surgeon for 3 weeks. She was left, she had to do her own dressings, everything like that for the first 3 weeks, and she got infections. And that's what I find. Not all doctors are like that, but it happens here. It's not going to happen with us.
Education, and that's what we did today, just talking about it, letting people know, oh gosh, if I'm going to go for a consult with someone, I'm going to ask, when I come out of surgery, how many follow-ups am I going to have? What's the continuous, what do they call it, the continuity, there you go, the continuity of care, what is that going to be like?
And one thing that's said quite a lot is the level of care over there is higher than they've ever received in Australia when they've had procedures. Yeah.
Beautiful.
That's the difference.
Dani, if anyone's listening to this, because you do men and women, if anyone's listening to this, what's the best way for them to reach out to you to have a chat?
Yeah, no problem. So they can either call me, I'm in Australia, so they can call me on my phone number, which is 0416 109 417, or just go straight to the website, which is Medi Makeovers. So it's MEDI, and then Makeovers, MAKEOVERS. And you can either just complete if you're wanting surgery, just complete the surgery medical form straight away, and it will give you prompts about photos, or just fill out the inquiry form, the contact form. Or you can email me direct on inquiries@medimakeovers.com. Okay. So there's many ways you can get in touch. But as I said, the quickest way probably is just jump on the website and fill out the inquiry form. It's very simple. And there is a call button on the website too, so you can easily contact me that way too. So, so we do clients from everywhere. Right now I've got a client from Sri Lanka going to Thailand. So it's not just Australia or just, like the East Coast of Australia. We've got clients from everywhere. Country towns, we've got lots of people from country towns because they would have to travel anyway to the major cities.
Yeah.
So for them, they said, by the time it's quicker for us to actually get on a plane and go to Bangkok than it is to have treatment in Australia. So a lot of country folk, which I love, they're just so beautiful. So they come down and and New Zealanders, a lot of Asian, we get people, expats from Singapore, Malaysia, lots of people everywhere. Anybody can have surgery or dental in Thailand.
Thailand, okay. Well, it's been an experience and such a lovely chat with you today. Thank you for bringing something that's almost like a taboo or hush-hush or secret or don't talk about it, or you're so bad, or you're lazy, or you're so full of yourself if you get plastic surgery. Like, I really hope that anyone listening to this today, it's kind of squashed a little bit of that. And there's so many reasons why someone would choose to get plastic surgery. And if you have clients that want to sing it from the rooftops, I'm sure you love that, Dani, but also you respect that sometimes people want to do it and not have people know. And that's the beauty. That's the beauty about the service and the business you provide, is if someone doesn't want other people to know, and it's very like, I want to do it on my own, I don't want anyone to know, you'll help that client. But then also, if you've got a client that wants to tell their whole family and their friends in the world that they're getting it done, you will help them just as much.
Yes, yeah, absolutely. So I'm quite happy to speak to anybody, or if anybody's just a few questions, just unsure about certain things, or, one thing that we get from a lot of people is, I haven't told anybody about it, as you were talking about. Haven't told anybody about it because I think that I'm going to get, friends or family going to think I'm crazy to go to Thailand. Yeah. And, at the end of the day, the decision has to be yours. And if you do your education, you go and do your due diligence, you look at everything. And, I've got clients that, even though they might not want their images put on our website or whatever, they're quite happy to speak privately to clients about their experience. So, there's that side of it. But I don't like the idea of plastering before and after photos everywhere. I don't think that's right too, because one of the things is, it's a misconception too. If you don't look like the before photo, you might not look like the after photo. Every body is different. So you can, the doctor is there to tell you exactly how you're going to look. The other thing I must say is, we're very natural. The results are very natural. The facelifts are very natural. The breast augmentations are very natural. So it's not like you can walk out and you've got that windswept look of the face. It's not. The skill set of our surgeons is the latest technique. So we've had a lady that just had a facelift, and she says that people are telling her that she looked exactly like this 20 years ago. So, and they can't tell. They can't even see the sutures. They can't even see the incision sites because they're so well done. So, and that's the thing. You want to look good for your age. You don't want somebody coming up to you saying, oh, my goodness, how old are you? Oh, really? Well, I thought you were 20 years older or 10 years older. You want to look great for your age. You don't want to be 50 looking 20. You want to be 50 looking amazing at 50.
But also looking like yourself. I think that's the thing is in this day and age, as women, as we age, we're not allowed to get older. And I like the hint of looking around your age, but not looking your age. But I think looking like yourself, like still looking like everyone's natural beauty.
Very important.
Yeah.
Yes. Very, very important. That's one thing that I really push. It has to be a natural. That's something that the surgeons that I work with, that was something we all talked about. It has to be a natural. You have to look like yourself. You can't have these, because, obviously we've all seen the facelifts that have gone a little bit crazy and people don't look like them. No, but all of our clients, they look fabulous.
And before you go, I just want to, we've touched on this, but you do offerings where if there's a group of people that want to come over together, you do have that option. So if there's a group of people and one friend could get dental, one could get boobs, one could get a nose, one could get ears pinned back. It could be a family trip.
Yes.
You do offer those services as well?
Yes, yeah. So we've got situations that maybe one lady has decided that she wants surgery and she's opening her conversation to her friends, and suddenly the door opens up and they're all like, oh, I've been so, I haven't talked to anybody. I've really wanted to go, but nobody's really, too scared. Everyone's too scared to talk.
Yeah.
We've had situations where, groups of people, we had a group of 10 people go over and they all knew each other and they all had different procedures. Some had similar, but, actually we had 3 facelifts in that group, and then we had, breasts and tummies. And they were all able to come over. They all had their individual hotel rooms. They all recovered. It was great. It was actually an incredible bonding situation between all of them. One thing we will start to redo, because we did before COVID, was we did offer groups that would go over, and if people are worried about traveling on their own, they can join the group, but we haven't set that up just yet because we're still obviously getting back to normal again post-COVID. But that will happen. But let me tell you, there's also what we have is we've got clients traveling all the time that are over this. So even if you are traveling by yourself, we do introduce you to other clients that are there by themselves. So you might want to go down to breakfast together. Absolute amazing friendships have bonded over these situations as well, where they've all met in Thailand and they've never known each other. This was amazing. We had 2 ladies that lived in a country town in Western Australia. They were in the next street from each other, never met, and they met in our hotel having surgery. It was crazy. I remember at breakfast, and I'll tell you what, I could sit here now for the next 5 hours telling you stories that have happened overseas with amazing women. But these 2 women, they came downstairs, they had breakfast. Where are you from? Such and such. Oh, Western Australia. Oh, we're in Western Australia, this suburb. Oh, I'm in that suburb. Which street? Oh, you're joking. Their houses weren't back to back, but they were literally back to back, a few houses apart. Wow. And they both lived there for like 20 years. And they just went, oh, my God. And it took them to come to Bangkok to have treatment to develop a friendship. It was incredible.
And they were trying to probably do it on the secret too. They both were probably trying to do it on the quiet. And then when you're trying to do something on the quiet, you see someone from your neighborhood.
Yeah. That was funny too, because we had a mother and her 3 daughters from Roma in Queensland that came over. And they decided they weren't going to tell everybody. The 4 of them came over and they all had treatment because the mother was the grandmother. So the daughters had all had children as well. And when they went back, they all looked so incredible. They started telling everybody in Roma. I think Roma's a little town in Queensland. We got so many people from Roma that were just so, oh, my God, I know so-and-so, and they told me about you. And next thing you know, the floodgates opened in Roma for Medi Makeovers. It was amazing. So we have a lot of women that come over and don't tell anybody. And then obviously because they're scared. Clearly they're scared. Yeah. I can understand that. And then they come back, they've had an amazing experience, and they go back and tell the world, about everything. And I just sometimes go, it would be nice if people can talk a bit beforehand. Or a lot of women have said, I just didn't want to tell anybody because people won't understand. I didn't want to hear any negativity. I needed to just have my head in the right space to go over. But that was amazing. So we've had many situations like that between women. Oh, women are amazing when they get together and, in a little bit of a painful situation, they just help each other out so much. They're so amazing. We are so amazing.
I was going to say, we are. We're so amazing. Yeah. But, thank you for, I would love to introduce you to my podcast family as our resident plastic surgery guest. So anything to do with plastic surgery, you're our lady, you're it.
Thank you.
You're
we will have. Well, I tell you what, my surgeons are lined up, ready to chat too. So they're quite happy to help out anybody too.
We'll chat to them because it's about just letting people know that the option's there, and from a credible source, not from Google. And this type of stuff can be great when it's word of mouth because it's legit. It wouldn't have it any other way. So thank you for taking the time today, and I've really enjoyed our chat. Thank you so much for listening. I hope you enjoyed today's episode and it has inspired you on your self-care journey. Please feel free to share this with a friend and subscribe over on Apple Podcast. I really love hearing your feedback. So guys, please feel free to write a review on Apple and let me know which part of this episode resonated with you the most. To fall in love with yourself is the first secret to happiness. To find out a bit more about Self-Care Studio or the Studio Chat podcast, head over to my Instagram page, self_care_studio, or on my website, selfcarebybarbaraThompson.com.au. Really look forward to seeing you on the next episode. Look after you. And I'll catch you soon. Bye!